Hello, RT is 54-year-old man who presents with depression and a desire to take control of his life again. He has depressed mood for the last 6 months due to his heart attack that was in 2015. He neither has interest in his hobbies nor likes to spend time with friends. And he has struggled recently with his ability to concentrate at work. Artist states that this season is particularly difficult for his depression with the colder weather, holidays, and spending his birthday alone, all this contributing to his overall feelings of worthlessness. RT does not exhibit suicidal ideation or any symptoms of bipolar disease, mania, or anxiety, and he doesn't express any symptom of insomnia. He took citalopram 2 years ago but stopped it due to erectile dysfunction and diarrhea as side effects. He would attempt quitting smoking if he could control his depression and start exercise if he could breathe better. He doesn't have severe breathlessness at rest but complains of shortness of breath when exercises. He would love to exercise again and lose some extra weight. RT had myocardial infarction and he was treated with PCI. Medical Past medical history: he has obesity, dyslipidemia, COPD, myocardial infarction, and depression. Family history: cardiovascular disease and depression. Social history: he smokes 1 pack per day, drinks alcohol occasionally, but was more in the last 2 weeks. He's a widower. His wife passed away last year. He has allergy to adhesives, and medication that he's taking are metoprolol 50 milligram, fluticasone 100 milligram, one inhalation twice daily, albuterol 2 puffs every 4 hours as needed for shortness of breath, atorvastatin 80 milligram once daily, and aspirin 325 milligram once daily. High priority problems are depression and COPD. Low priority problems are myocardial infarction, dyslipidemia, and obesity. For the assessment of diseases, first, depression. He has uncontrolled moderate depression by the patient HAM-D score of 16. He experiences depressed mood for 6 months and has constant feelings of guilt, worthlessness, and fatigue. Besides, he loses interest in hobbies, which means he has anhedonia. In addition, he complains of having trouble with ability to concentrate at work, and all of these confirm diagnosis of major depressive disorder by the DSM-5. Goal of therapy: clinical improvement in symptoms with at least 50% reduction in HAM-D score. For the assessment of COPD, the patient has GOLD stage 2 moderate COPD as evidenced by a FEV1 over FVC of 0.63, which confirms diagnosis of COPD, and post-bronchodilator FEV1 predicted of 52%. Also, he has a history risk factor of tobacco use while not willing to quit right away, and symptoms of shortness of breath with poor exercise tolerance and mild wheezing. The patient has CAT score of 21, which is more than 10, and one exacerbation, so he should be allocated to treatment group B per GOLD guidelines. Oxygen saturation is 95%, respiratory rate 18, blood pressure 138/86, and normal body temperature. The goals of therapy for COPD are to reduce symptoms such as shortness of breath and exercise intolerance, lessen lung function reduction, and prevent exacerbation. Assessment of current therapy. The patient is taking medications for COPD, including albuterol and fluticasone. Those work to control the patient's symptoms and prevent exacerbation. However, the patient is still suffering from mild shortness of breath and trouble breathing when exercising. So for recommendation, I recommend adding LABA to treatment. So discontinue fluticasone and start Advair, which contains LABA, and inhale corticosteroid. Advair 100 over 50 to be taken twice daily. Start sertraline 50 mg once daily. Reduce the dose of atorvastatin to be 20 mg once daily. Continue albuterol to be taken as needed, 2 puffs every 4 hours as needed. I also recommend taking annual flu vaccine. So taking the flu vaccine for this season and taking Brubnavar or BCV13 in the next March or after. The rationale behind that were GOLD guidelines and inhaled corticosteroid combined with LABA. This combination is more effective in improving lung function and reducing exacerbations in patients with exacerbation and moderate to very severe COPD. This comes with evidence A. The patient has tried citalopram, which is SSRI, and discontinued it due to its side effect. Trying another SSRI is recommended by the guideline. The patient's lipid panel indicates that his cholesterol in the normal range. However, his 10-year risk of atherosclerotic cardiovascular disease is 8%, which indicates that the patient is still a candidate for taking moderate to high intensity statin, and in this case atorvastatin 20 mg is a moderate intensity. Per CDC, adults aged 19 to 64 years old who smoke cigarettes are at risk for pneumococcal diseases, and they are candidates for pneumonia vaccines. The Bremnavar then taken Pneumovax at least 12 months after. The patient already got the later one, which is PPSV23 Pneumovax in the last March, so it's better to get the other pneumonia vaccine BCV13 next March. Monitoring. So monitor for serotonin syndrome, reduction in intensity of major depressive disorder, or any clinical worsening, and suicidal ideation. Also monitor uric acid, CBC, liver function, and urine output. For Advair, headache, your upper respiratory tract infection, and oral candidiasis. Also monitor improvement or maintenance in COPD symptoms and check bone mass index at baseline and periodically. For patient education, we want to encourage the patient to cease tobacco because it's recommended by both COPD and dyslipidemia guidelines. Also consider weight loss. Encourage adherence to medication and follow up within 4 weeks for reassessment. Thank you.